children in the world today are diagnosed with type 1 diabetes are under the age of 5 years, and that's very worrying because these children are the most difficult ones to diagnose.
When we diagnose a child with diabetes and then we tell a mother or father, the family members, that now this child is to take 4 injections every day, which you are supposed to give. Now a mother has never held an injection in her hand, and suddenly we make them give 4 or 5 injections to their child. So what we need to give is education. There are some children which we find that, we actually counsel and we have an educator talk to the child, but still the blood sugar levels are really, really bad.
Type 1 diabetes is not like type 2 diabetes, which is seen in adults, where the disease is caused by lifestyle and improves by change in lifestyle and some oral medications. Whereas in childhood diabetes, it is entirely dependent on insulin injections. So, a diabetic child needs to take at least 3 to 4 injections every day, and if still not controlled, sometimes insulin pump therapy is required in these children.
So, our aim is what we call as holistic care. We run what we call in medical terms as a multidisciplinary clinic, which means we have pediatricians, we have pediatric endocrinologists, we have dietitians, we have psychologists, we have social workers, and we have diabetes educators. So we have this army of people who are looking after these children, and we have children coming to us from all over Maharashtra, and there are some children who come from as far as Hyderabad and Goa to our clinic. So we have been running this clinic for over last 7 years now with the help of supporters. In this clinic, as we call it, the holistic clinic, there are over, as I said, 350 children, and we are counting. Every day we have some new child coming in. When we say we are looking at a holistic approach, we don't want to just make children survive. We want to give them a good life. A lot of our kids have done really, really well. We have children who've passed 10th standard. We have a child who just passed his 12th standard when the child had a cataract in both eyes. So this is something, after that the child has had the cataract removed and now is doing very, very well in an engineering college. And though his marks in 12th standard were not very good, I thought he was a real winner.
Now, India being a fascinating land, a lot of people would offer various treatment modalities for this condition, such as non-allopathic practices where they use herbal medicines or homeopathic medicines or Unani therapy. But I would definitely like to warn people that these therapies do not actually help a diabetic child, and in fact the condition goes on worsening to a point that the child may actually lose his or her life. Therefore, people should be very careful when they decide to change over from well-proven allopathic medicines such as insulin to any other form of therapy. The biggest danger for these children in our country is lack of resources. Any child who actually is having diabetes requires regular supply of insulins, regular syringes, needles, then equipment to check sugar on a regular basis such as glucometers, and these are quite expensive.
I appeal to whoever that can come in and contribute by way of time, by way of resources, by way of people, that this is something that is a crying need for our children. And at the end of the day, the health of our children is the health of our nation. And there is never enough. So this is really a strong appeal that people can come in and help in whichever way that they can, organizations, NGOs, in whichever way. And one thing I can guarantee is that every little ounce of resource that is put in will go into the right direction.